Hi, and welcome to this training and supervision. This is module number 3, and I'm Dr. Kristen Kinsevich, licensed professional counselor and assistant professor of counseling at Evangel University. In this module, we are going to cover techniques in supervision, and there'll be 3 videos within this module. The first video is going to be about student self-report and reviewing case notes. So as techniques in supervision, these are kind of the most common ones, the ones you've probably already heard of and done much of, but we'll kind of go through some more specifics as to how to think about student self-report when they come and just share with you what's going on in their internships. Also, I use the word student and supervisee interchangeably, so it may be that you're supervising someone who is no longer a student. So any of this can apply. And then also we'll hit some highlights about reviewing their case notes. So as far as thinking about student self-report, it's important for the supervisor to assess how much the student is self-aware. We know that students and supervisees are in a developmental process, and they're only going to share with you the things that they think of to share. And so it may be that they're not really aware enough to bring the right things into supervision. Unfortunately, also, we have some times where students or supervisees may not be honest because they are ashamed of maybe mistakes they make, or they want to, paint themselves in a certain light with you. So we'll talk about that. And then also, we want to avoid a case management approach to supervision. And that's just what I call, when we're kind of just checking on cases, checking boxes, and we're really not paying attention to supervisee development. So let's get into student self-awareness. I think it's important to give opportunities for students to self-assess, and that can help you determine how self-aware they actually are. So things like asking them what they believe are their strengths and their growth areas can be really telling. If your observations of them are different than the things that they say about themselves, then that may point to the fact that they don't have self-awareness, and that can impact the kinds of content that they bring to you in a supervision session, the kinds of things they think to say about how their sessions with clients are going. So, to develop this, you can ask some self reflective questions. We're going to explore this a little bit more in the next module, but it's really helpful to kind of slow down supervision a little bit and ask your student or supervisee to reflect on their feelings. So, what was it like sitting across from that client? How are you feeling this week? Obviously, we don't want to cross into the role of becoming their therapist, but it is useful for their development for them to pause and self-reflect. When we talk about specific techniques in supervision in the next, it's actually in this module, but in the next video, we'll be talking about a technique called interpersonal process recall. And so that'll go into this a little bit more. We also want to model self-reflection, and so much of supervision is just modeling, what a good counselor acts like and what you think about, what you say. And so in supervision, you can demonstrate self-reflection by sharing maybe a clinical story or observations of yourself, your own professional growth over time, maybe even mistakes that you've learned from. Again, similarly to in clinical work, you can use that your judgment about when self-disclosure is appropriate. You don't want to make the supervision session about you, but you can show them how to think about a clinical case, how the reflections and the things that you learn from mistakes. That self-disclosure or vulnerability can actually kind of make them feel a little bit more comfortable being honest with you. So let's talk more about student honesty. It's important to notice what your supervisee does tell you and maybe even what they don't tell you. So do you notice a pattern where they only highlight what they're doing well? You get a sense that maybe they're trying to impress you. And maybe they're just a really awesome student. And so they're not trying to like be dishonest, but they also are just, thinking everything is great. And again, that might speak a little bit more to the lack of self awareness as well. But even when they report doing well, it's great to encourage them. You don't want to discourage them, but to even give them some thoughts on clinical alternatives, that there's never one right answer in how we proceed clinically. So, okay, that sounds great. What else might have been another option? If you went down this other road, where do you think it might have led? So that you're kind of pushing them to tell you a little bit more. Also, if you think that a supervisee is not being honest with you, then it might be good to ask them directly, gently, but seeing if there's some details. Press them a little bit on the details by asking clarifying questions, or maybe even kind of expressing confusion. That kind of like, gee, I'm a little confused. This doesn't make sense to me. Can you help me understand this? Again, similar to what we might do in clinical work if we have to gently challenge or confront a client. And then, of course, if any of our students are, in some way not being honest with you and you're concerned about that, we certainly would want you to connect with us, our program director, and our, there's always a faculty supervisor for the student. In our case, we can always consult with you and definitely reach out to us if there was any concerns about student honesty. Now let's talk about avoiding case management as a supervision style. I think it's very easy to fall into this, and honestly, I think most supervisors do kind of land here, just because sometimes it's hard to know what else to do. So hopefully these training modules will give you some new ideas. But we don't want to just check boxes and focus only on reports on clients during the supervision session. We really want to focus on the students' professional development. Yes, we want to make sure that client welfare is being taken care of, and so that is definitely important. But we want to also leave a lot of room in supervision sessions for exploration. So ask open-ended questions instead of saying, "Okay, tell me what this session was like." That, yes, that's open-ended, but it focuses more on kind of the details. What did they say? What did you say? What did they say? What did you say? So something like, is there a new skill that you've tried this week? Or, how did you feel when the client, didn't respond the way you thought? That kind of thing. I think it's important to avoid micromanaging. And so, again, we want to ensure the safety of all clients, but we don't need to know every single detail of the session. So often what I do in my supervision is I help my students understand if there's any safety concerns or client welfare issues, that would be something they would bring to supervision first. And then after we've kind of, okay, you concerned about anybody, then we can go a lot of different directions in the rest of the session. And so when we allow supervision to vary, there's room for that. So the supervisee might bring one or two topics or experiences each week. And you can use those to kind of jump off of into various clinical skills or processing. And so each supervision session, just like therapy, is going to feel a little different week to week. So I think there's a lot of room to do some creative things, which we'll talk about as we go. Let's talk quickly about reviewing case notes. We want to make sure that the records are on time and complete. We want to make sure the student or supervisee is documenting the right kind of information. And we want to make sure that as a supervisor, we're using documentation review as a training tool. So let's talk about some basics. I always emphasize with my students that their progress notes need to be written in a timely manner. And so I know we all know, even licensed counselors who are always kind of buried under a mountain of paperwork and they're always behind on the progress notes. The problem is, as you I'm sure know, those progress notes end up being of poor quality when they're written too much later than the session. So I always train my students to basically have a session, get good at time management so it ends, at the kind of 45, 50-minute mark, and then write the note, take a breather, and do the next session. So it's session note, session note, session note. And at the very latest, if a day is complicated, I get that, do it the next day at the very latest. If you are not watching this closely, then the students will get more and more and more behind. So do consider that an important part of your supervision process. Then ask yourself, is the record complete? So we know that students are learning, so they might miss a signature line on an informed consent or release of information. And so I periodically audit my supervisees' records just to make sure, particularly at the beginning or new cases, that everything is correct. I learned to do this when I realized much after the fact that there were some important documents that had gotten missed by some students. And then beyond progress notes, of course, we've got other aspects of the clinical record like initial assessments and treatment plans, and those need to be on time too. We're training students to be ready to enter the field. And so make sure that you're clear with them about your agency's expectations as to when these items are due and hold them accountable to those deadlines. Now, we want to make sure that they include the right information, and so you should teach the student the difference between case notes and process notes. So they might want to keep an internship journal. Actually, our students are required to keep a reflective journal that they turn into us that does not have confidential information, but just is their kind of processing of cases. And that obviously is their own personal record, and that's what's kind of in the legally known as process notes. Case notes are the client's permanent record, and so obviously, as you know, you need to be careful and aware of what you're putting in there. The case notes should connect to the treatment plan, and they should read like a narrative. So it's important to teach your supervisee to document which goals and objectives they worked on. So instead of a note reading like a script, the client reported this writer responded with this, kind of like a line by line, play by play. We want to avoid that and connect it more to what the student and the client did together. So explored past trauma by, whatever, some intervention. So kind of helping them write a good treatment plan, and then from that, write their notes to emphasize, okay, here's the part of the treatment plan we were doing. Here's the interventions I was trying. That's what should be documented. And of course, we know that writing skills and writing levels vary. So, clinical notes read a totally different way. It's a new and different kind of writing. And especially at the beginning of supervision, it's well worth it to train your students or supervisees how to form sentences using clinical language. And so walk them through in a supervision session, the note, and kind of talk through ways to reword. Give them examples of notes that you've written if you can kind of scrub out the confidential information and just have some examples to show them. And so teach them, the style that's preferred in your agency or practice. Let me just see. Yep, just one more slide here. So again, it's really important to use record keeping for training. We want to connect the notes with supervision. So when you're overseeing their record keeping in terms of accuracy, timeliness, it also can inform you, okay, here's what the supervisee is coming in and saying they want to talk about this week. Were there different things that you noticed in the notes that may kind of feed the topics that are important to cover in the supervision session? So again, going back to the the supervisee self-report, that can be helpful to, kind of look at what their notes are telling you. We also want to look for development. And so hopefully the students' progress notes and treatment plans are improving over time. And I would hope that you might challenge the student to think in more complex ways over time. So most students kind of start in a CBT solution focused approach when they're writing a treatment plan because it's very easy to quantify those types of goals. But can they go beyond that? Can they write a person-centered treatment plan, or can they write a psychodynamic treatment plan, and how do you make those things measurable? So again, depending on your agency and what types of services you offer and what types of theories you might even be trained in yourself, that will vary. But I think just encouraging and helping your student become better and better at this. And then, of course, it's hard to teach what we don't do ourselves. And so modeling good record keeping is important. Again, showing the student examples of progress notes or treatment plans, that can really help them. So those are some basics. The next video, we're going to go into a specific technique called interpersonal process recall, which I think is a really fun technique. So hopefully I'll catch you at that next video.